Yeah, so we presented some data from the ACR FLAIR trial looking at the sudden deaths that we observed. So in the first 771 patients randomized, half to FCR, half to Ibrutinib Rituximab, we saw 10 sudden or unexplained deaths, of which 8 were in the Ibrutinib Rituximab arm and 2 were in the FCR arm. And so we looked at variables that predicted for the likelihood of a sudden, unexpected or a sudden cardiac death. And it was really the presence of previously treated hypertension or other cardiac disease. So of the 8 patients in that arm, 7 had a previous history where they were on treatment at the study entry of mainly hypertension. And that compares to about a quarter of patients in the whole trial. So there's a significant relative risk for patients with a previous cardiac history. We also did a meta-analysis of other trials in that poster. Tal Munir presented this data at ASH and showed that actually FLAIR isn't an outlier compared to most of the other trials of us, in patients where the mean age was 70, we saw similar levels of sudden death. The FLAIR age was a little bit lower. The only outlier is the ECOG 1912, where there's a younger age group of patients. And so I think it allows us to identify patients where we might want to either think of alternative treatments or think of monitoring them more closely and controlling cardiac risk.